Hi, I'm Susan Aycock, I'm Chief Executive here in East Kent, and I'm standing in the shell of our brand new Elective Orthopaedic Centre here in Canterbury. And I'm just going to go and meet some colleagues who are going to help me with my podcast this week and tell you all about the work that they're doing in this unit to prepare for the most fantastic elective orthopaedic service that will be the envy of the country. I'm Susan Aycock and I'm the Chief Executive here at East Kent, and I'm standing with three colleagues in what will be our fantastic elective orthopaedic theatres. And the noise you can hear in the background is the fact that it's still being drilled out and made out. So just to start with, if I can get my colleagues to introduce themselves. So Mr. Yanni, Omar Yanni, can you
Omar Yanni, orthopaedic surgeon.
Julia Blackwood, General Manager for Trauma and Orthopaedics.
And Kylie Brown, Orthopaedic Theatre Coordinator here at Canterbury.
So I have to say this is one of the most exciting and really big projects that we've been involved with. It's been quite a long time coming. We were just discussing when the idea and the concept first started, but the idea of centralising elective orthopaedics and going at scale has been around for a little while. But Omar, tell us about what happened when Professor Tim Briggs came down and really got us going on this idea.
So 3 years ago, we had just had a bad winter where many elective lists were cancelled because of the then flu epidemic. And we wanted to find a solution for the age-old problem of cancellations in winter. We were approached by Professor Briggs, who is a very eminent orthopaedic surgeon, past president of our British Orthopaedic Association. And he set us the challenge of centralising our elective surgery in such a way that we would never have the threat of cancellations in winter. We looked long and hard at this, and we found fairly quickly that we had to build a whole new unit. And of all the places that we had to build it, we found that Canterbury was the most suitable, but this took a lot of time to get the funding for this. Eventually, we got our capital from central government, and here we are.
Yeah, fantastic. Now, one of the things that, because Professor Briggs was really keen that we modernise, so it wasn't just really about centralising orthopaedics and going at scale, but it was also about modernising, and he really pushed us around the efficiency. And I remember Julie, he kept going backwards and forwards, wasn't he? And we had to do a lot of work on trying to show how much more efficient as well as effective this could be. So what was your involvement?
When we look back at our lists, when we've been operating in our normal theatres back at QEQM and William Harvey, we have an average of about 1.6 patients per theatre list. Professor Briggs insisted we get up to at least 2. So in order to do that, we've looked at the way we use our resources and decided we were going to try and extend our operating day in order to get the most out of our unit, so we can increase the throughput for our patients. We're planning for around 4,000 operations in the first year, which would be a big increase for us at this point.
So we wanted to go at scale, we wanted to centralise, we wanted to be able to have a very efficient service. But you were just telling me, Kylie, about real attention to detail to save minutes and to really get a smooth an incredibly well thought out journey. So just explain some of the considerations you've been given.
Absolutely. So we were given a plan a few years ago now of this is the plot we've gone for, following on from our business case. We've managed to work closely with our build team here, all our architects, to get every little ounce of space. So for example, we've allowed the prep rooms that we could have one patient in our theatre and we could be laying up for the next nice and safely, all infection control compliant, and we've made sure that every ounce of space we could find, every bit we could use, was about making that pathway better and making sure that we can have our patients in a happy place, our staff really happy because we've got nice restrooms for them, there's some natural daylight in those areas, and just making sure that this centre could be everything that it needs to be and a bit more. As you say, modernising, we've pushed on, making sure that we've got the best laminar flow we could find, we've got the best operating lights, we've got x-rays live for our surgeons to reference back to as they're operating. It's all about, as you said, every bit we can get out of it and making it what it needs to be really, and a bit more.
Yeah, and I was just intrigued. So just in terms of the way it feels for the patients, they're not going to come from the wards, are they? No. They're going to walk in, and so it's going to feel like they're part of their recovery right at the start, aren't they?
We start at the beginning. They come in. They're an elective patient, so they come in for our bespoke reception area. It's all getting redone. They come in, they wait. They're seen by a nurse. Their whole journey is tailored to them. So it's about how we get them from their preparation surgeries, how we're consenting into the end surgery and their recovery. So how they're getting into our recovery room to our wards, we work really closely with the wards to make sure the pathway hits that point so they feel involved. It's all about them. It's what they need to get better. They've waited a long time now. This joint could be life-changing for them.
Yeah, I think one of the things that I remember when we went down to Gloucester as well, Omar, and I think one of the issues that we heard then is that often trauma is happening at the same time as elective, and often it's the elective patients that end up not having quite the same attention. But just in terms of some of the other points of attention, in terms of that patient's recovery and the physio and all of the other things, they're going to have total focus on the elective patients, all the staff, aren't they? So what are some of the other things that you've thought about?
Yeah, so this has allowed us to redesign the whole patient journey. So not only do we have the highest standards of cleanliness, air handling units, space in theatres, but the pre-operative journey, the assessment, making sure that they're seen by a physiotherapist soon after their operation, getting our length of stay down, standardisation of anaesthetic, standardisation of surgery. The whole journey will be the most efficient it can be. And I think when you build a new unit like this, it gives you all pause so you can redesign to the highest standards. So I think that opportunity is much harder to do it while you're working, much easier to do when you're actually opening a new unit. And the other thing this allows us to do is it'll free up theatre space and surgeons to deliver on our trauma objectives. So the theatres that were constantly under pressure at the William Harvey and QEQM will now allow us to operate on patients soon after they're admitted, so that the bottleneck in getting surgery for trauma will be removed.
Yeah, and I guess we always thought this would be a great unit, but given COVID and some of the size of the waiting list that's built up, never has it been more important to have a very effective and efficient unit that we're about to bring on the stream. What's your sort of feelings about that, Julia?
I mean, we've seen an exponential increase in our waiting list, and this will give us that chance to really eat into that. And then when we look further on down the pathway, we've got that therapy support, so these people are going to get the very best care. And their turnaround on our wards will actually be a lot quicker than it was before. So we've got 7-day support. We're working into the evenings. It's going to be a brilliant patient experience for them.
I think you're going to have a unit to be completely proud of, and I can see people coming to have a look at this unit in terms of how it's organised and how it's constructed. I think we're going to have an orthopaedic department and unit which is going to be the envy of the country.
We can't wait.
Well, congratulations, it's brilliant, unbelievably well thought out, and can't come soon enough. Can't come soon enough. Thank you very much, Omar, Julia and Kylie. Thank you very much for showing me around.
Thank you.
Thank you.